Hi friends, welcome to my channel. My name is Joseph Rimpon, and today on the Couch Talk we are going to be talking about a very interesting journey. I have my friend here who happens to be in the PhD program here at Wayne State University. But not only is he a PhD student, he has actually gone to the medical school and he is actually a doctor. But then he decided that he would leave the medical practice to come to do a master's, first of all, and then a PhD. And so today we are going to learn about his journey, about how he went through from medical school straight up to PhD and his experiences. So without much ado, I want to call on him to introduce himself. So who are you?
Hi everyone, my name is Nicholas Ajibolosu. I'm a fourth year student in the physiology PhD program here at Wayne State, and I'm happy to be here.
All right, thank you for being here. So the first question I really want to first of all ask is about basically what has been your trajectory, right from your undergrad way up onto the PhD, right? What did you do? So what would you and basically just give us like a rundown of your academic and your professional trajectory.
Okay. So I finished medical school. I went to Kwame Nkrumah University of Science and Technology in Ghana, and I finished my medical school there in 2016. And from 2016 to 2018, I did my housemanship training, which is equivalent to the internship year here in the United States. So I did that for 2 years. The first year at Tamale Teaching Hospital, and the second year at Kumasi South Hospital. And after that, I did a 1 year of locum work as a medical officer in Ghana. And then in 2019, I went to Newcastle University to study a master's in medical sciences. And in 2020, actually in January of 2021, I came to Wayne State University to begin my PhD program in the physiology department here.
All right. So I want to ask about what was your motivation, right? What drove you to leave the medical practice, which is a very lucrative job, I mean, quote unquote, in Ghana, to want to come and do a master's or even a PhD? What was that? What motivated you to do that?
Right. So my response to that is twofold. So the real reason or my real motivation was the fact that I've always been inclined towards the basic sciences. I I always knew I wanted to have something to do in the basic sciences, and so even throughout medical school, I had beaten it into my head that I was going to um, after my degree, pursue postgraduate degree in one of the basic sciences like physiology or anatomy, and then become a professor in that. And the other drive was I think I am I'm able to teach.
Okay.
And I got a lot of positive feedback from my colleagues and my lecturers in medical school that I would make a good teacher. So that was my main motivation. But to what the other reason that I tell myself to keep myself on track in this trajectory is that there are a number of disease conditions that patients I encountered came with on a daily basis that scientists have still not yet found solutions to. And so I thought it wise to pursue postgraduate degree to get involved in research that seeks to understand the mechanisms underlying some of those disease conditions, so as to help come up with new therapies to tackle those. And so that those have been my main motivation.
Right.
Yeah.
Thank you for that answer. So I mean, another question I really want to ask, when you were talking about your motivations was that, I mean, so you've done a medical degree, you had a medical degree, and you have also gone to do a master's, and now you're doing a PhD. In your own opinion, right, or in the opinion of other people you've heard from, right, what do you think is the fundamental difference between doing a medical, getting a medical degree and a master's and a PhD? Are they different, or are they the same?
Yeah. So they are totally different, actually,
Okay.
especially the medical degree and the PhD.
All right.
For the medical degree, essentially, you are trying to you have large amounts of information, medical knowledge of disease conditions, how the disease conditions present, like what are the symptoms and the signs, what investigations can you perform to come to a diagnosis, and once you've arrived at a diagnosis, what medications do you use to treat the condition, what surgical procedure. So for medical school, you're essentially consuming all of that knowledge, all of the already established knowledge. And whereas the PhD, on the other hand, you are trying to push the frontiers. You are questioning all those established knowledge, trying to come up with new knowledge that in some cases contradicts already established knowledge. So they are totally different areas, and it's been interesting discovering that for myself.
So, which one do you think is difficult?
That's a good question. Which one is the? So I feel medical school, I wouldn't really say it's difficult. Don't get me wrong. It requires a lot of dedication, but I feel it's a lot of information that you have to take in. But understanding the material itself may not necessarily be difficult. But for a PhD, especially in the basic sciences, you are trying to find new knowledge. So I don't know.
I mean, it requires you to do a lot of thinking outside the box.
Yes.
Which is not usually very easy to come by if you are someone who is just used to doing a lot of memorization and trying to find mnemonics to understand or to memorize. I guess, like, and that's what I see it.
Yeah.
I mean, at least.
Yeah.
What do you think?
Yeah. I think along the same lines. So as you said, PhD requires a lot of thinking outside the box, but both of them actually require synthesis as well. So putting one and two together to come up or to make inferences. And medicine also requires that. You still need to. It isn't just about memorizing and trying to or regurgitating. It also requires synthesis, because it's not every day that patients will come with textbook presentation of disease conditions.
Okay.
You need to have insight. You need to have a high index of suspicion a lot of times. So in medicine, there's a popular saying that you don't go for the zebra, you should go for the horse. So if a patient presents with a certain set of signs and symptoms, you are encouraged to think about the most likely or the most possible cause of that. But in a PhD, you are encouraged to think about the zebra. You think about the rarer things. Don't just get distracted by the most common things. You should think outside the box, as you said.
Right.
So very different fields. Yeah.
Right. Talking about that, there's one very big question that I normally get, which is about like how to study, right? So being and I know from K University, you were one of the best medical school students during your time. What do you think is one of the most effective habits or effective ways to study in medical school, or even during your master's or PhD?
Even before I answer that, I should give shout outs to a lot of they know them, so I'm not going to mention names, but there were some very, very intelligent and smart students in my class.
Okay.
So, but you said one of the best, so I'll just accept. I said that's
Yes, you're one of the
compliment.
best.
Yeah,
Yeah, yeah. Right.
yeah. So I think the most effective strategy is being actively involved in the learning process. So when you read a material, the same material, you read it over and over again. Sometimes you get um, illusion. You get this illusion of knowledge when you are actually just being familiar with the
You're
material.
just used to it,
Right?
right?
Yeah. But to actively learn, you should, for instance, you read a passage and then you close it and then you ask yourself, so if they ask me a question this way, how would I respond to that
Mm-hmm.
question, right? Or how would I teach this to someone else?
Mm-hmm.
So that is one way of going about it. You should be actively involved in the learning process. Don't just passively read the material.
Mm-hmm.
And there's also something called spaced repetition, where when you read the material once, you should allow some time to pass before you go trying to recall or trying to recall it again. If you read the material 5 minutes ago, it's very likely that will be fresh in your memory. So if you test yourself then, you will do very well. But if you wait after 2 or 3 days and then you try to test yourself again, you find out that your you may recall less compared to when you learned it afresh. So when you allow some time to pass and then you expose yourself to that material again, that um, introduces some sort of reinforcement.
Mm-hmm.
And so those are two of the main techniques that I would mention. And it's important to solve a lot of questions. Don't just read the textbooks and keep reading. You should solve questions, and that helps a lot. Um,
Right.
yeah.
That's nice. Right. So, what would be your advice for medical students who, or even not just medical students, those who are done with their medical degree and they are doctors, who want to basically pursue a similar line of career trajectory as you? I mean, how was your experience like in the first place? You trying to switch between being a doctor, going back to study, and then coming to do a PhD. I mean, what was your experience like, and what would be your advice to people who want to follow similar trajectory?
Mm. Yeah. So I would. So for me, the experience it hasn't been an easy journey. I think the most important advice I would give is that you first and foremost do a very deep soul searching to be sure that you want to pursue a career in the basic sciences. Um, if you are in medical school or you're a doctor, I would advise that first you try to get to know what really motivates you or what you really enjoy.
Mm-hmm.
If you find that you really enjoy clinical practice, then instead of coming to do a PhD or trying to use a PhD as a route to come to the United States, I would advise that you take your time, prepare for the licensing exam of whichever country you intend to travel to, and take those exams and then focus on clinical practice. But if you know that you have any interest in the basic sciences or you would want to be involved in research,
Mm-hmm.
then you would you can go ahead and apply for a PhD program and come here. I'm saying that because doing a PhD it can be very challenging. It is rewarding, but it can be challenging. My first few years in the program were a bit rough for me. In fact, at a point, I thought about going back home because I actually missed clinical practice.
Oh, you
So
missed clinical
I
practice.
did. So
Okay.
even though I told myself that I knew I wanted to do the basic sciences,
Mm-hmm.
I having practiced for 3 years, I kind of got hooked onto the instant gratification I was getting. So a patient comes with some emergency, some acute heart failure or something, and you're able to introduce an intervention and the patient recovers remarkably. You go home feeling fulfilled that you solved someone's problem for them. You saved their life, right?
Right.
But a PhD or basic science research isn't really like that.
There's no instant
You
gratification.
don't get that instant gratification. So it can be quite frustrating.
Mm-hmm.
And so you should have that internal drive or that passion to want to do a basic science research before you embark on this journey.
Mm-hmm.
If you don't have that, even a single iota of that, then I would encourage you to focus on clinical practice and then take the necessary licensing exams and then come do your residency here straightforward. Um, yeah, that's what I would advise. But yeah, if you're interested in the basic sciences, you should definitely go for it. Those are the things that win the Nobel Prizes in some decades later. So yeah.
So I want to ask a question too, similarly on the same line. So what are some of the different paths that MD PhD, graduates take, right? I mean, I know you mentioned that, something about like being a professor or teaching in a college, right? That's one direction. What other directions do you normally MD PhDs also go into?
Right. Yeah. So, off the top of my head, I can think of three main directions.
Okay.
The first is what you mentioned, being a professor and teaching in a college.
Okay.
And so that could be clinical, in clinical education. So either clinical education or basic science education. So you're either teaching the basic sciences like anatomy, physiology,
Mm-hmm.
biochemistry, and so on, or you are doing clinical education, or you are teaching medical students clinical methods like at the bedside. How do they examine patients and how they should think and put signs and symptoms together to come up with a certain diagnosis, and how to interact with patients. All of that would fall under being a professor and teaching. The other is doing purely clinical practice, where you are mainly seeing patients, taking care of them, and that's it. You are not really involved in any teaching or anything like that. And the third approach, which is actually probably a newer pathway, is working in industry.
Okay.
Yeah, so one of my big role models. I don't know if I should mention his name or not. So he kind of set the pace for us. He after medical school he went to do his PhD in the UK, and he's currently working with a pharmaceutical company.
Okay.
He was actually one of the big people who spearheaded the development of the COVID vaccine during the pandemic
Oh,
in the
okay.
UK. So that's one approach. You can get yourself involved in the industry side of things where you are.
You're basically doing research.
Yeah, you're basically doing research, but not in the very academic sense of it. You're actually doing it on a more practical level as well. I'm trying to develop new drugs or vaccines and stuff like that. Yeah.
And I mean, in terms of how much they pay, how do they compare? For instance, if you're like a medical doctor who probably, how would they
The pay
the pay normally
compare.
compare? Do you have an idea of that?
Well, I don't really know exactly how much they earn, but I think, well, before I even give any ideas, I would say they often say that if your interest is to make money, medicine isn't the field for you because
Oh, okay.
they, right, that's what they say, that there isn't,
But you guys make a lot of money though.
well, that's what they say. Anyway, but I think as a doctor, if you manage your finances well, you will live a comfortable life. So medical practice itself, especially in the developed world, like the United States, Australia, and some European countries like Switzerland and so on, they pay is very good for medical doctors if they are only fully in clinical practice. In academia, I don't think it pays as well as clinical practice. And then industry work is somewhere in between the two, I believe. So it's a little better than academia, but depending on which specialty of clinical practice we are comparing to, industry work may be at the same level, or if you are in the surgical specialties like neurosurgery, orthopedic surgery, or plastic surgery, you are likely to earn more than the average salary of someone in the industry. But then again, it depends. If they rise very high in the ranks, then they can earn even as much as a neurosurgeon. Yeah.
But I also do understand that, like, for instance, if you're a surgeon, it takes you probably another maybe 8 years
Yeah.
to get there, right? So I mean, if you really think about it carefully, it's more or less like getting another PhD,
Yeah.
right?
Yeah.
Which sends you back there too.
Yeah.
But I mean, that's pretty interesting actually.
Yeah.
So the next question I really want to ask about too has to do with so how do you go about searching for your schools and then applying to both the master's program that you went to and also the PhD program, and what were the bottlenecks that you had there that you had to find ways to fix?
Yeah. So for the master's program, it was my first couple of years trying. So I actually tried going to do a master's program right after house job. So that was 2018, but I was not successful because I didn't have a lot of guidance. I was just trying things on my own.
Okay.
And it didn't really work out well. I got a couple of admissions, but I didn't get any funding.
Okay.
But then when I came across the Commonwealth Shared Scholarship, and I found that they had a list of programs and schools they supported, I went through the list and found something that closely related to my interest. And so I went in for that. So the fact that I was going to get funding for the medical sciences MSc was one of the big things that encouraged me to apply for that. When it came to PhD applications, I had a little bit more knowledge at that time. I had a couple of friends doing their PhD here in the United States, albeit in different fields. Some of them were in engineering and data science and statistics, and but then they gave me some useful advice that enabled me to make a good search. So the main things I considered were, one, my interest. My interest was the biggest factor. So I'm not sure if I mentioned, my clinical interest is in obstetrics and gynecology. And so I wanted to do a program that would allow me to do research in the area of obstetrics and gynecology. So in searching for programs, I would search the name of the program and then add maybe reproductive science research to it. So that was one, my interest, my area of research interest. And I found Wayne State University to be one of the few programs in the United States that did a physiology PhD and had a concentration in reproductive sciences. The other thing that influenced my choice of schools was the type of professors available in the university. I found that Wayne State had a lot of MD PhDs. In fact, one of my advisors, my main advisor currently, is actually an MD PhD himself.
Okay.
And in his lab, there are 3 MDs, 2 MD PhDs, and 1 other MD MS holder. So I wanted to be in that environment to kind of gain a lot of mentorship from them, because they are already in the path that I'm trying to follow.
Okay.
And then funding. Funding is also another important thing to consider. You need to be sure that um, you you will be able to get help in paying for your tuition, and then you get a good stipend to
Mm-hmm.
live on. I was smiling some few minutes ago because one other reason why I chose Wayne State, so I like the PhD graduation gown.
Actually, I've been. So you mean the green one?
The green one, yes,
Oh,
yes.
that's interesting.
So I had admission from some other universities, but I dropped them because the gowns didn't look nice to me.
That's funny. That's funny.
Yeah.
But I mean, what did you put? What did you do to put together like a very good application, a convincing application? Though, I mean, what was your focus more on, and what did you focus on?
So I think maybe what helped my application was the fact that my personal statement or statement of purpose was uh, original. It was heartfelt. So I drove it. Um, I made I drew inspiration from my clinical practice.
Okay.
So I gave specific examples of things that motivated me to want to pursue a PhD. I talked about how I encountered some patients that came with certain complications of pregnancy. For instance, I listed specific complications, severe preeclampsia. And I actually remember, so I wrote about a patient. Of course, I didn't write the patient's name, but I wrote about the case because it was a case that I don't think I will ever forget. We ended up losing the patient sadly, but that loss kind of drove me, or it drove me to want to do research to find solutions for the problem that led to the demise of that patient, so that we
Okay.
can prevent other people from
No, facing the same
facing
thing.
the same issue. So I was very practical with my statement of purpose, and I poured all my passion into that. That's one. And then I was fortunate to have some very good mentors and professors who wrote very strong recommendation letters for me. And I also reached out to potential advisors way ahead, at least a year ahead of the time I planned to come and start my studies. And so they tell you it's not required, but you putting in the effort and being proactive actually is a plus. So a lot of my yearmates were actually interviewed for the funding they had, but for me, fortunately, the professor whose research I was interested in at the time was the head of a certain fund. He had access to a certain special fund,
Okay.
and because he was interested in working with me as well, he just um, gave me that funding for my first 2 years of the program. So reaching out does help. If you reach out to the right people, you can actually obtain some favors. Of course, it's all by the grace of God, not just by my own efforts. So
All right.
yeah.
That's good. So another question I want to ask about, which I think normally happens with both PhD students and also with medical students who are in their residency, is something we call burnout, or I don't know, like extreme stress, right?
Yeah.
I'm not sure whether you faced that somewhere during your journey, both as a medical student and also as a PhD student. And if you did, how did you, go about, you know, trying to deal with that?
Yeah. So I did experience it since medical. I have been experiencing it. Even now, I still experience it sometimes. Um, in I think so in medical school I got to a point I felt no, this is going on for too long. I'm tired. School, this, how can you be schooling for so long? But I think what helped was sometimes taking a step back, taking a break, from
right.
all of it to recuperate, and having a group of friends around you.
Okay, good
That
hack.
Yeah,
Okay.
and then having a hobby also helps. Um, I I had to develop a few hobbies. If you can get one or two outdoor activities to do, that is even better than just sitting in your room all day. Even if you don't have an outdoor hobby, just going for a walk sometimes helps you to get a refreshed mind, and you can come back in, and then um, you are really energized to continue your work.
Right. So if I get it correctly, the things that helped you was getting hobbies, also basically having a good backing by family and friends,
Yeah.
and also basically taking some days off or some time off, right? So have you had to do that during your PhD?
Taking some time off.
Not just taking some time off, like I said. What's
The
what's
main thing. Yeah,
apps
so
have you
during
been
my
using?
PhD years, I have. So I was fortunate to have a wonderful roommate when I first got here, Gibson. You know him, yeah. So Gibson really helped me settle in, and he really helped me when I had very difficult moments. I was really burnt out from my PhD. He
That was
introduced
the
me.
first year, right?
Yeah, that was the first year.
First year is
Yeah,
the hardest.
yeah. He introduced me to some of his friends, and so
Mm-hmm.
we would sometimes go hang out on
Mm-hmm.
weekends,
Mm-hmm.
or go to some African restaurants and go eat.
Mm-hmm.
I think there was one time we went to even play volleyball in the sand somewhere, and so that's really helped me. And talking helps as well. So still in the first year, I reached out to, so Wayne State has counseling and psychological
Mm-hmm.
services.
Caps, I think
CAPS,
caps.
yeah,
Yeah.
yeah,
Counseling.
and
Yeah, I think counseling.
mental health unit. You can reach out to them as well. I reached out to Wayne State's CAPS, and they matched me with a student psychologist,
Mm-hmm.
and I would meet him, I think, once a week,
Mm-hmm.
just to chat, and then he actually encouraged me. So that time I was staying in my room a lot.
Mm-hmm.
It was in the
During
middle of
COVID, right?
COVID. Yeah.
I feel like during COVID, everyone was just stressed out. Actually.
Yeah.
Yeah.
So he actually tasked me that every week, was
Mm-hmm.
it every week or every day actually, every day I should ensure that I go out for a walk at least a few minutes a day,
Mm-hmm.
because all my classes were online, so I had the temptation to just hide in my room all day and not go out was very high. So going out for walks sometimes help.
Did exercise help too?
Exercise helps too, yeah.
Right.
Exercise helps a lot, yeah.
Yeah. Right. So we are moving. I mean, towards the end of our discussion. But I want to ask for, like, final tips and advice for medical students, PhD students, people who want to explore MD, PhD. What would be your final advice for them? And general tips of surviving those who are in the same position as you that are struggling. What would be your final tips for them?
Um, I would say that, so for medical students and medical doctors who are considering doing a PhD,
Mm-hmm.
uh, I think the most important thing is first do a deep soul searching to be sure if you are really interested in having a research career, because a PhD, especially in the basic sciences, is a totally different area, and it can be really challenging if you are separating yourself from clinical practice, where you get instant gratification and all of that. So you need to do a deep soul searching to be sure that you're really interested in it. And Jesus said you should count the costs before you carry them. So you should really think about it. If you think about it and you realize that it's not really in you, you are just thinking about using the PhD as a route to come to the United States, then I would advise that if you can, perhaps you should focus on studying for the licensing exam. You take that and then you come here and continue your clinical practice. That's it. You come and do your residency. That's one. If you do have interest in the basic sciences, so you are considering a career in academia, then by all means you should go for it. It's going to be challenging, but you should definitely go in for it. I found some quote somewhere that says, if we begin in certainty, we might end in doubt. But if we begin in doubt and we are persistent in them, eventually you may end in certainty. So even if at the start it seems challenging, it's okay. You should just persevere and be persistent. Eventually your breakthrough will come. For those already in the PhD program, keep going. It's going to be worth it in the long run. It's hard. We are all going through that process, so we know it can be hard, and we are not alone. So yeah.
And seek help, right?
Yeah, and seek help.
And find a community.
Definitely, yes.
Right. All right. Thank you, Dr. Nicholas, for indulging us with your kind words and giving us the tips and ideas about how to survive in both grad school, medical school, and also even during masters. Right. Thank you. And this concludes our third episode of Couch Talk. And I hope this was useful to you. If you like this kind of content, subscribe, like, and share. See you in the next episode. Bye-bye.
Bye.